cashback మీ క్లోజింగ్ కాస్ట్ లో
Hello everyone, I'm Varsha Singh, your host and presenter for Healthline on TVAsia Telugu channel. I welcome you all to this show which brings you a lot of information about a lot of conditions, diseases, and how you can take this information to improve your life. In this show, we bring healthcare providers, physicians, specialists who have been working in this field for years. They are specialists and they have the information that can make your health in a better way. In your world, this information has a really significant role because all you want is to stay healthy, have preventative practices in your life, and make sure that you have right information to take care of your health. So today, please welcome Dr. Swati A.Sathe. So you have heard Dr. Swati A.Sathe before. Dr. Swati A.Sathe presented on clinical trials in our earlier episode. And today she is bringing us another very important topic. Dr. Swati A.Sathe is a neurologist and she is working with Huntington's Foundation. Her primary area is clinical research in Huntington's disease. She is also a voluntary associate professor at Rutgers Medical School. Her specialty is mainly in extensive experience in genetic research in neurology. So please welcome Dr. Swati A.Sathe on another episode of Healthline. Welcome, Dr. A.Sathe.
Hi, Varsha. Thank you so much, and thank you for having me back. It was a lot of fun last time, and I hope this time it turns out to be a success as well.
Welcome, Dr. A.Sathe. And I know that you have another very important topic that you are going to share it with us. And as I say, it's health information, which is really presented in a very clear and very simple manner that our viewers can understand and implement these practices in their life. And they also understand what exactly it means when they are talking about this disease. Let me ask you, what do you bring us today? What is it that you really think is very important for our community members to learn?
So, Varsha, I thought today we could focus on memory disorders and Alzheimer's disease, especially with the aging population. It's very important to understand about this condition. We hear about it from everywhere. We read about it in magazines. And I just thought it would be important to focus on this and really understand what it means to have memory loss and what's the difference between, say, memory loss and Alzheimer's disease. So that's what is the topic of presentation today.
Thank you, Dr. A.Sathe. Can I ask you a little bit further, especially because our viewers of South Asian origin, how important it is for all of us to learn about these diseases?
I think it is very important to recognize these disorders. Like I said, we have increasingly aging population, and overall there is not enough recognition of what memory loss implies for this population, how we can not necessarily prevent it, but what we can do about it, how we can take care of these individuals. So I thought we could focus on that today. And it's also important to know if there is something we can do in our life to prolong it, to prevent it. What are some conditions that we can particularly look for and avoid or treat so that we can at least help the person live as much independent life as they can.
Thank you so much, Dr. A.Sathe. I have read somewhere that we all are because of our memories. Our whole existence is because what we remember and all the experiences that we have in our life and how our brain connects those memories and dots together And everything depends on those memories, how we enjoy our life, or we experience joy or sadness, and how we recognize people around us, and how we go back in our past and reminisce about all those good moments. So memory is an really integral and important part of our life. And thank you so much for bringing this topic to our community, so that we can keep our memories alive. So my next question would be, what is first thing that our viewers need to understand? Because memory has a lot to do the parts of the brain. So if you can elaborate on that.
So, like you said, Varsha, most of our life is based on our life experiences, what we have learned from them. And so memory does shape almost everything that we do in our life, or what decisions we make in our life. And it may not be a topic that we can cover in a short session like this. But what I thought I would do today is just highlight the very prominent things about how medicine understands memory. And you have to look at it from different perspectives as well. Every culture, every ethnicity has a different perspective on memory. So what I present today is what's the current medical understanding of memory. And in my first slide here, I'm just trying to show, first of all, the location of the brain, and you can see that it perfectly fits in your head. And there are some parts labeled here. Of course, most of these terms are scientific, and but it's very difficult to find a picture of the brain without scientific terms attached to it. But it just kind of highlights what parts of the brain may be really important for memory, because all different parts of the brain have different function. Technically, every part of the brain is involved in memory. It is not easy to delineate it as such, but the parts that are labeled here, so to say, are the ones that are perhaps most important in encoding memory, or in retaining memory, or in retrieving memory. But as such, the whole brain is involved in the function of remembering things and bringing them back to recall. So that's the first slide. And then, very often we talk about memory as if it's a thing. It's like we think, like, how we have black hair and black eyes and things like that. So memory is not really a thing. It's really a concept. And it doesn't exist as a part of your body. Like, it doesn't exist like your nose exists or your arms exist. It is really a complex kind of a constructive thing for the brain. And so every time that we remember something, or every time that we recall something, or we perform something, it is done afresh. It is a new thing that the brain does every time. The more and more we do it, the more and more it is easier for the brain to recall that thing, or retrieve that thing, or perform that thing. So that's what we call practice, or that is what we call as becoming an expert at something. That it becomes so easy that we can do it faster, more easier, more efficient. But even then, every time we do a particular thing, it is afresh that the brain does it. It's a new, every time you have to do it again, okay? And the way the brain kind of does it is that it links certain experiences or certain inputs that it gets with certain, so for example, if I have to remember suppose I'm trying to remember this situation, then my brain will have what my eyes saw in this particular situation, and what my ears heard in this particular situation, and what location I'm sitting, and the time of the day and the month, and all of those things that are actually coming from different parts of inputs, right? What I'm seeing is coming through the eyes, what I'm hearing is coming through my ears. All of those experiences, the brain will kind of link together. And so every time I think about this session that I had with Varsha, all of those things will be joined and remembered together. And that's a very important thing. So it is a lot of integration of stimuli that are coming from different sources that the brain has to piece together and make it like a web and make it a memory for that episode.
It's very beautiful when I'm visualizing what you are saying. And when you talked about if you do the task again and again, your brain actually really remembers and keeps the sequences together. And then your memory, like, you get better and better. When you were saying that, I ended up thinking about singing. Like, when they do riyaz and they continue to sing the same song again, that's how they become an expert in singing. Same goes with gymnastics or all other
activity. Yeah, because that circuit that the brain formed the first time to learn a task or understand a task, number of times we do it again and again, that circuit is strengthened. And it becomes easier and easier to recruit that circuit because we have done it so many times. So of course, the most important thing for memory or to make something easier for the brain to do is, of course, practice.
Mm-hmm.
And so if we just keep following the same example, this is on the next slide. If we are, say, riding a bike and we have, say, already learned to ride a bike, right?
Mm-hmm.
So that riding the bike is one kind of memory, right? The attaining the control of the bike, the coordination, the balance, that's one kind of circuit. Now, if you're driving on a road, then if you know you're going to go from your house to your friend's house, then knowing that road is a different kind of memory, right? That's a different thing. Remembering the rules of biking, like where is the stop sign or which road, what side of the road you can drive, what rules you have to follow, all of that is a third set of memory. And then while you are doing all this, suppose you see a big truck or something coming in front of you and you get that a bit of nervous feeling, that's a fourth kind of memory. And so when the actual action of riding the bike is happening, all four of these memories are somehow integrated together to actually make that action happen. We are doing it seamlessly. It seems very easy, but for the brain, it is recruiting four different kinds of circuits. But if you were to go from your house to your friend's house every day for 15 days, then these four circuits now almost will become unified or become one circuit and will become easier for you to do that.
Wow.
Does that make sense?
Yeah, like I understand now. Whatever you said, I can put it as we go in autopilot mode when we remember.
Yeah. So now the 15th day you'll be in autopilot because now you know the road, you know the rules, and you know your bike very well. So now it has almost become an automatic memory.
I think it happens to so many car drivers when they are driving and suddenly they realize that, oh, I'm driving without even knowing where I'm driving, but their brain is actually taking over their drive time, right? It's called mindless driving, which is not really a good idea. So this is interesting, very interesting to learn about how our brain works. And we still call it a mysterious organ because we have not deciphered it completely.
So this is just very, very, what do you say, superficial way of looking at it. That is, of course, it appears very simple, but we have very little understanding of how the brain is actually achieving this apparently very easily.
When you said about repeated tasks, I was thinking of my schooling in India where we were supposed to memorize all the multiplication tables again and again. And I think that made us really good at mathematics.
So for purposes of our understanding, we split memory into what is very easily, very visible to us. So we can see there are three parts to our memory. One is that we receive information, right? So we receive it and we encode it. And then the second part is that we store it. And the third part is that we retrieve it, right? So these are the three simplified way, but a straightforward way of looking at how a human brain might use its memory or how it can put its ability to remember into action. Right? So based on this, we also, there's a fourth angle to it, that not only we encode it, retain it, and retrieve it, we also learn to shape our future performance or future decisions based on the experiences of the past. So that's a fourth aspect to memory as such. And then in the next slide, it looks rather serious, and it is, but I just wanted to show a picture of a nerve cell. And this is not to intimidate anybody, just to indicate how complex this whole thing is. But what I would like to focus on is that this big red blob that you see in the middle of the picture, that's really the cell body of a neuron. And that's almost the center, like the processing unit. And then there are kind of these fibers that shoot out from the neuron. And here you can see that there are a few small fibers that are mostly red. And then there's a very long fiber that is covered with this blue insulating kind of sheet. And so this is a basic structure of most neurons in the body. These short red fibers that come out from the body of the neuron, they are the receiving part of the neuron. The red blob in between is the processing unit of the neuron, and the red fiber with the blue insulation is the output of the neuron. So the neuron receives input from multiple sources, but more or less has one output. And then you can see in the highlighted circle above in the center, it shows the end of a neuron with some yellow bubbles in it. And that's how really a neuron communicates with the next neuron. So at the end of one neuron and the receiving part of the second neuron, there is a gap, and that gap can, whenever a neuron has to communicate, it releases a chemical called a neurotransmitter into the gap, and the neuron on the other side, the receiving side of the neuron, receives that neurotransmitter and transforms that into information. So the information goes through a neuron in a form of electrical conductance, and at the point of communication with the next neuron, it is really a chemical conductance. And again, the picture on the right, you can see that in the square on the right, it is kind of shown a picture of this chemical transmission between two neurons. I just wanted to show that as an interest to our viewers.
That's actually really interesting. And I'm not sure how many of our viewers have actually seen the nerve cell in a health show. So this must be really an interesting fact that they can take home and see how their neurons are working. And the way you shared about the neurotransmitters, so there is an actual chemical exchange occurring when they are exchanging information, correct?
Yes. And there are a number of labeled parts in this picture. Again, any biology picture has a number of labeled parts, but it also kind of indicates the complexity of each nerve cell and how many organelles or how many sub-organs within the cell are involved in processing of information.
Thank you so much, Dr. Sathe. I just wanted to go a little bit further, and you have been talking about the retention and the coding. If you can explain what are the stages of memory and how exactly we retain the information that we notice.
So there are four aspects to memory. The three main aspects from the brain's perspective are encoding, storage, and retrieval. But the first and the most important aspect of memory is really attention. Because the brain can only retain what it was paying attention to. And a lot of times when people say that they don't have good memory or they don't remember something, very often the fact is that they have not paid attention to what the fact was or what the event was or what the episode was, and therefore they cannot retrieve it because it was never encoded. And this is something that I think parents keep saying over and over to children, pay attention, pay attention. It's very important, because if we have not attended to a stimulus, there is no way that that stimulus can be encoded. Now, this attention can be voluntary when you really want to focus on something, but many a time attention is not involuntary, but it is semi-voluntary in a way, as long as the brain or the mind is receptive to the work that we are doing. So I'll give you an example, like you used the example of driving before. If we are attentive to driving, meaning while I'm driving, if I'm only focused on driving and not involving myself in other activities, or I'm not distracted by other thoughts, then actually I will remember what I saw on my way. I will remember the stores I saw, or if there was a big tree, or if there was something else, I will automatically pick those things and I will start remembering them. But if I'm always distracted while driving, if I'm thinking about other things, I'm listening to songs, or if I am talking on the phone or some other thing, then I will not remember the things that I saw on the road. For example, the same stores, I might go back on next day and say, well, I never saw this yesterday, but because of no attention. And so the most important thing for memory, or if there is something that a person really wants to encode in their mind, attention is the most important thing. Once we have paid attention to something, and it has actually been recognized, so to say, by the brain, then it is encoded in our memory. There's one process for encoding, then there is a process for storage of that, and then there's process of retrieval. So in a lot of ways, the process of encoding and storage in the brain is unlimited. We can actually encode and store any amount of information over our lifetime. When we say that we don't remember something, what we actually mean is that we either didn't pay attention, that's the first part, or we cannot retrieve it. We cannot find where it is stored in the brain, and we cannot bring it back to our immediate working memory. That's the problem. But actually the capability of a brain to store or encode is unlimited. And the way to enhance perhaps retrieval is to engage in more challenging activity, or to present yourself with more difficult tasks, because that really makes your brain start retrieving more and more of the information that you have. So a lot of time, trying to do things that seem difficult or seem impossible is actually a good challenge for the brain, and to actually start making yourself retrieve more of the information that you actually may have gathered over your lifetime.
So I think that's why to improve memory, there are some suggestions such as learn a new hobby, learn a new art, learn a new activity, or do math problems. So how much valid all these suggestions are?
No, I think they're very, very valid. The more that we train our brain to bring the information that we have stored to our working memory, the better brain will get at it. Everything in the brain is really a matter of practice. The more we challenge the brain, the better, the more efficient machine it becomes. If we just let it not function, if we are just using very small areas of our brain, the very little capability of our brain, and then just working by it, that really is not a good thing for us. And there is a lot of research that actually shows now that doing challenging work in your lifetime, or being more educated in your lifetime, or always being engaged in intellectual activity in your lifetime, will actually prevent against dementia, or is protective against dementia. And there is enough research to suggest that.
Dr. Sathe, that was very interesting information about how we process and how we create memory. So my next question is, are there any types of memory, or what is the difference between one memory from another, and why we don't remember everything?
So again, this classification is very superficial, and it is really for purposes of our understanding of brain function. I don't know if whether there's a definite delineation between all of this, but broadly speaking, there are 2 or 3 types depending how you look at it. There's a short-term memory, there is an intermediate-term memory, and there's a long-term memory. We will talk about short-term and long-term. So short-term memory is really something that we use for the immediate work that we are supposed to do. So it is almost like, if somebody tells you their phone number and you're dialing it on your phone, that's short-term memory. That will not be encoded into any long-term process. Somebody just told you the phone number, you dialed it in your phone, and it's gone. One day later, if somebody said, can you repeat that phone number to me? Very few people who have really psychedelic memory will be able to remember that, but most people will not have encoded that number. It was just a very short thing. This kind of memories are usually the ones that we hear. So the sentence that somebody said, or like I said, the phone number, some conversation that we heard, only if the brain thinks that it is important, or if we think it is important, if it is something that we must use at a later time, then we will decide that we need to encode it and store it and make it available for future use. So it depends on how much importance we attach to that particular thing, and it also depends on how much attention we have paid to that particular thing. That short-term memory will become a long-term memory. But we do a lot of things on short-term memory. So for example, while you're cooking, you use your short-term memory to say, did you add this ingredient? Did you add that ingredient? Did I do this? Did I do that? A few minutes later, you may not even recollect what you have actually thought at that moment. So for all these short kind of working things, we use our short-term memory. Again, whether it becomes long-term memory or not depends on the importance of the episode and how much attention was paid to that episode. Long-term memory, on the other hand, is really something that is stored. It has been encoded, and that brain now has that information. Like I said, our ability to encode long-term memory is unlimited. Most experts would say that whatever we use in our lifetime of our brain capacity, whether you're a professional or you're working or whatever you do, we probably are not even using 5 or 10% of what we are actually capable of doing, or what we could be capable of doing. So we don't even know how much memory a particular brain can store in their lifetime. And sometimes you surprise yourself, especially if you go back to an old house where you lived, or if you meet an old friend, of how many things you remember about them, or how many episodes you remember, and they simply were not you didn't even know that you actually remembered so many things. And we do have a lot of store. Unless it is required, we don't bring it back to retrieval, but our store is very long. And again, in the long-term memory, we classify it, we make parts, we say something called as, again, this is very much for processes of learning or process of understanding. The brain may not actually see a difference between each one of these, and they are not removed from each other. But there is something called as procedural memory. And we get examples of this. So for example, if you have been using say a website or some account, and for 7 days you have not logged into that account, and you open the computer thinking, I wonder if I'm going to remember the password. And even before you finish that thought, your fingers are already typing the password. And so that's procedural memory. It is, some people say it's muscle memory. It is just there. It's almost automatic for things that you do over and over again. Then there is semantic memory, which is mostly to do with language, storing of information about the world, factual information, information about your job, and so on and so forth, mostly fact related. And then there is something as an episodic memory, where we encode episodes, like a party you attended, where the whole episode is encoded in your memory as one bit, or a movie that we saw, or a vacation that you took. And so it becomes the whole thing becomes encoded together, and those circuits are now linked together as one form of memory. And this, we can see this many a time when we think about a vacation. When that thought flashes in your mind, almost the entire vacation flashes in front of your mind. It's very difficult for you to divide the vacation into day 1, day 2. The whole episode is imbibed in your mind as one thing. So again, a little superficial. There are more types of memories. I just highlighted the ones that we kind of see all the time, or which I thought were interesting. And then this is kind of the memory pathway on the next slide, where you input, and we call that as sensory memory, memory that comes from your eyes, from your ears, from touching, from smelling, tasting, all of the sensory inputs that we have. Again, most important, attention. If there is no attention, there is no encoding. The rest of things are even pointless to talk about. If we have paid attention, if we think this is worth it, we first put it in the short-term memory. If we think it is really worthwhile, we put it in long-term memory, and then we have a method of output or retrieval for that. And every time we rehearse it, we practice it, that circuit becomes strengthened. It is easier for the brain to recruit that circuit and perform that activity much more easily.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన, సంతృప్తికరమైన లావాదేవీలను చేసిపెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 908-304-9621 or 908-337-1289.
Hear it from you, that short-term memory, how we store all this information in our brain, and for how much time. And actually, we are not paying attention to all this. So something that I'm learning from you today is that every time now I'm going to do any show, I'm going to use this word, pay attention, because that is actually going to prompt everyone to really pay attention, so that they will retain this memory. So thank you so much for sharing this memory pathway. Very interesting how we learn from our eyes and ears, and sometimes we learn and remember from our nose as well.
Oh, in fact, the oldest organ associated with memory is actually the sense of smell. And sometimes the sense of smell recruits the strongest memories, especially if they were pleasant ones. So a lot of times you will have very pleasant memories associated with the food that you had at a particular occasion, or from somebody's kitchen, like your neighbor's kitchen, or something that your mother made or your grandmother made. And in fact, the smell circuit and the memory circuit are very closely related, and they are one of the oldest, developmentally the oldest sub-organs of the nervous system, coming as, in the form of evolution.
Yeah,
So smell is
I
actually
have
a
heard.
very strong sense
Yes,
for me.
I have heard that they are also called as olfactory memories, and it also is associated with nostalgia, that you
Yeah.
smell something and then you immediately go back to that phase of your life, and that I remember I did this and I ate this here, and it really generates. It's really interesting that that olfactory memories and that nerve is not really studied extensively. So I'm still looking for little bit more information on olfactory memories in future. My next question is something that now we talked about memory and how we retain memory and what is the memory pathway. And we know that one of the most debilitating disease that we all are afraid of is losing the memory. So Dr. Sathe, let's give us some information about what are those conditions that we should be actually trying to avoid, or if we can.
So in a way, yeah, it is not just about memory, but largely speaking, one of the most difficult and dreaded memory disorder is dementia. Right? So dementia by itself is a condition where uh, either some or all aspects of the memory are affected. So that means that if we say that the person has dementia, what we actually mean is they have difficulty either making new memories, or they cannot retrieve their old memories, or both, or even more than that. But by and large, that's the broadest or the simplest definition of dementia. There's way more angles to it, but I'm just going to keep it at that simple definition. The thing about the word dementia is that it in itself indicates that the process is continuous, that it is permanent, and it is irreversible. So it is very serious of a diagnosis and a condition, because we are essentially saying that there is a process in the brain that is affecting the memory, that is affecting the patient's ability to either make or retrieve memories and other aspects of brain function, not just that. In addition to that, this process is going to continue, and it is probably irreversible. So it is almost like saying that, this is it. And this person is going to continuously experience disability from now on. So it is a very serious diagnosis, and people should make very serious consideration before we give this diagnosis. It is not an easy diagnosis to give. So dementia is not normal aging. Of course, the biggest risk factor for dementia is old age. And just like we see these kind of loss of function, so to say, in other organs as well as we age. We see arthritis as we age. We see loss of vision, or vision becoming weaker, hearing becoming weaker. All of those, just like other organs have aging, the brain also has aging. But dementia is more than just normal aging. It is really a pathological process, and a very serious one at that.
So, Dr. Sathe, going further, is dementia the only disease that we should be worried about, or there are other disorders related to memory that we should be aware of and taking some measures to prevent it if we can?
Yes, of course. Something as simple as B12 deficiency can cause difficulty with memory. And especially when people are vegetarian, then the availability of B12 in diet is very less. And I cannot tell you how many cases of B12 deficiency I've seen in my life. And that's the simplest thing that anybody can do to help their memories, especially if somebody is vegetarian, to make sure that their B12 intake is adequate. You can supplement it in the form of tablet. That's to me, that's the simplest thing that anybody can do to help themselves and their memory, of course, is to make sure that the B12 level is normal. And I say this, like I said, especially for people who are vegetarian. I cannot tell you how often it is, how under-recognized it is, and how simple it is to treat. So I really urge the audience to make sure that pay attention to B12, and if there is a deficiency, you can get the level measured in your blood. If there's a deficiency, please supplement it. You could be at any age. You don't have to be older for this. It can occur at any age. Vegetarian diet has almost none of B12 sources. And so that's an easy way to do. There are other things that can affect memory. So for example, a lot of times people who have depression, they often complain of memory problems, or they often have difficulty with retrieval of information as well as encoding of information. And that's usually because of the distraction, or the encoding is because they are distracted, the attention is not there. And retrieval is because they're so preoccupied with their depressive thoughts that it becomes difficult for them to retrieve information. So and treatment of depression will essentially treat the memory problem. So there are a number of other conditions that can affect memory. And of course, a lot of, if the person has any, like a heart disease or any other sickness that is of serious nature, that can also affect your ability to perform well in terms of memory. So a number of other things can affect memory, not just dementia. And whenever we are evaluating a patient for dementia, we have to consider all of these other things as well.
So I have this burning question when you are talking about dementia. What about Alzheimer's? Is it the same or it's different?
Alzheimer's is a type of dementia because it is primarily a brain condition. It causes loss of brain function, and it causes memory issues. But it is not the only type of dementia. The thing about Alzheimer's is that it is the commonest type of dementia that can occur in older individuals. More than, I would say, 85-90% of dementia that we see in old age is Alzheimer's. So a lot of people do equate Alzheimer's disease with dementia, but there are a number of other kinds of dementias that can occur. Alzheimer's is just the most common one. And so here on the next slide, we show Dr. Alzheimer, the one who described dementia. And just to give a few numerical facts, that there are about 6 million people in America who have dementia in 2017. So the number is a little larger now. And because we have a lot of aging population, it is estimated that by the time it's 2050, 1 in 85 people globally will have dementia because of the longevity of life. And just like we said, age is the biggest risk factor for dementia. The percentage of population that can be diagnosed as dementia goes up from 3% to 47% as you go from the age of 65 to 85. And again, if you are looking at people in their 90s, then we can say that more than 50% of people in their 90s can be diagnosed or do have the diagnosis of dementia. Yeah.
Thank you so much, Dr. Sathe. Can you give us a little bit more information on Alzheimer's?
Okay, so I as you can see on this slide, the pathology, or what really happens to the brain in Alzheimer's, is that it loses a number of its brain cells. And that's really the primary problem, so to say. So as you can see in this slide, the size of the brain shrinks. The brain, the fluid spaces in the brain start to becoming larger because the loss of cells is replaced by fluid. And it's not just that there is neuronal death or loss of neurons. The neurons that are existing, they are also diseased. There is a definite pathological process, that is, the neurons get filled with abnormal material that we call as tangles and plaques, and that does not allow those neurons to function, and eventually leads to the death of these neurons. That is the primary pathology, very simplistically put again, for Alzheimer's disease. And here I have put a little picture of a MRI. And on the left side, that's an MRI. The cut is taken from the top like that. And so the patient is facing away from us. He's looking in the front, and we are looking from the back side of the, we're looking at the back of the head of the patient. So on where the figure is A, where you can see the letter A written, that's the right side of the patient. And so it's a kind of a mirror image. But anyway, on the left side, you can see that that's the brain of a normal patient. There are fluid spaces that are the dark spaces in between, and you can see how what their size is. Whereas on the right side is the brain of a patient with Alzheimer's disease, and you can see how big the fluid spaces have become, and the brain material or the brain substance has really shrunk a lot. And I think most viewers will be able to appreciate that it is really very obvious in this picture. And what the patient really presents with in this kind of situation is that they have a long-term episodic amnesia. That is the primary presentation of Alzheimer's, meaning that they simply cannot remember or encode episodes, all of it. And a lot of times, we get asked these questions. We see so many people who come and say, "Oh, I can't remember, I can't remember," and sometimes they have convinced themselves that they have dementia. the fact of the matter is that not remembering details of an episode is very different than not remembering the episode itself. And I also give this example to especially elderly couple who come, and I say, well, did your husband not remember to give you the message that your friend gave on the phone, or did your husband forget that your friend had actually called? And those are two very different things. He may not remember the message because he was not paying attention, or he didn't. but not encoding the fact that somebody had called is a little bigger deal than not remembering the message that was given on the phone. And that is hallmark of Alzheimer's. And then again, people just keep saying, oh, I have short-term memory loss, short-term memory loss. That's a little bit of a misnomer, because essentially what they're saying is that there is a lot of difficulty in encoding new information. So for example, if you and I were given 6 numbers or 7 numbers, somebody gives us a telephone number to remember, we might remember it in 1 or 2 attempts because there is some encoding happening. We can use our, and what the difficulty they're saying is that they cannot encode that new information that is coming in. And that's usually what is termed by most people as short-term memory loss. But really long-term memory and sometimes the procedural memory is pretty okay. So that's why people who are used to doing things over and over again, they can perform that activity without much problem for a very long time in Alzheimer's disease. Language is more or less preserved for a very long period of time. But eventually, as the person becomes more and more involved, then all aspects of memory get affected. But in the beginning, it is really this episodic memory loss and inability to encode information very quickly, what we would normally term as use of short-term memory, that's impaired.
So I would just tell everyone that if you forget things now and then, and if you forgot where you kept your phone, where you kept your clothes, or sometimes you forgot where you kept your bag or the car keys, don't panic and don't think that you have dementia. There is someone who can actually run some tests and ask you questions and explain you, especially neurologists like Dr. Swati A.Sathe, who can actually tell you whether you have true memory-related disorder. And talking about having accurate diagnosis, again, Dr. Sathe will advise the same thing, which I'm suggesting is always talk to your primary, because there can be some symptoms which are beginning, salient, correct?
Yeah.
And then if it is really bothering, then go to a specialist like Dr. Swati A.Sathe, who is a neurologist. So Dr. Sathe, I know that we have a lot to talk about. And we learned about some memory disorders such as dementia and Alzheimer's, but there are many which we really need to pay attention to.
Keeping in what you said, Varsha, about people complaining about memory loss of whether they forgot their car keys or where they left their bag. We see this a lot, especially in young mothers who are trying to handle, say, work and home and young children. And a number of times they'll complain about how they don't seem to remember anything. And most of the times the issue there is attention, or the issue is that they are so distracted, they're trying to do so many things at the same time that the brain is just not able to encode new information. And really that's not really dementia, and luckily it is not dementia, but we get to hear a lot about how people forget these small things and get concerned that this may be a real pathological condition. A lot of times dementia in the elderly is missed because most people are retired, and if they start getting less engaged in activity, or they start making mistakes in simple things, then the family thinks that it is because of old age, or because they've retired, or because they have very less engagement. And very often what we see is that, suppose a person was responsible for handling finances, eventually the spouse takes them over because they have started making little mistakes, they've started forgetting things to do, they start not watching TV so much or not reading the newspaper so much, they start becoming more disengaged. And by the time the patient actually comes for evaluation to a neurologist or to any doctor, it is very obvious. It is quite advanced, so to say, in terms of the dementia situation. And it has missed the notice of the family for a very long time, because there is a cover-up in the sense that they say, oh, he doesn't always remember the date or the year because he's retired, he really doesn't need to know that information. And our brain really doesn't work like that. Our brain does update itself every day on the date and the month and the year. Whether you're retired or not is really not a part of that. Or important events or important dates. It's something that the brain is accustomed to updating itself. And so if we start seeing these early signs in elderly, we should really get them evaluated sooner. Like we said, there are other conditions that we can treat. Make sure that the B12 is okay, the thyroid function is okay, but see if there are any signs of depression and try to address those. So there are other things we can do. We can try to make sure that other risk factors for dementia, which are diabetes and blood pressure and high cholesterol, we can try to control them. We can appropriately counsel the family about how to take care of the situation. In the early phases of dementia, sometimes providing stimulation to the brain may actually help attention, may actually improve their performance, even though we are not technically improving memory. There are medications nowadays that can improve attention. Some of them are recommended only in the early phases, some of them in the moderate phases. But paying attention to this situation earlier than later is always much more helpful. There are, depending on the country or depending on the culture, there are other supportive measures that can be offered to these patients.
Mm-hmm. Mm-hmm.
In general, the situation is much harder for the family members than sometimes for the patients, at least in my observation, because most patients with Alzheimer's disease do not have an insight into their issue. They mostly are not aware of how much memory they have lost or not aware of what they might be missing out. But it is much harder for the family members to watch the patient lose their skills or lose their capabilities. And at a point when they don't recognize their family members, it becomes really hard for the family to cope with that. We can provide guidance or we can provide counseling with respect to that. Any form of support we can offer either to the patient or the person who's taking care of the patient is always helpful in this situation. But not recognizing it or not bringing them to early evaluation is not very helpful. So that's what I would recommend.
Wonderful, Dr. Sathe. This is really, really an information that everyone can use and implement, especially those who are really worried about their parents. Just to ask you again, is Alzheimer and dementia genetically related? Is it a genetics or hereditary risk factor? Because many children who have parents with Alzheimer and dementia, they are worried that they might end up having it.
By and large, Alzheimer is not a genetic disorder as we consider genetic disorders, meaning passed on from parents to children because of one gene or because of a specific gene. Only about 10% or maybe even less of Alzheimer's disease per se is genetic or directly inherited because of one gene being affected. In those situations, the dementia is usually much early onset. It's almost in the 40s or even sometimes earlier. And that's a very different situation. Most Alzheimer's disease, as we discussed, the highest risk factor is age. And there are some other risk factors. Smoking could be considered one of the risk factors, or some other environmental factors, occupational factors, and so on. But it is really not a directly inherited. Maybe if there are multiple family members affected by Alzheimer's in a family, their risk may be higher than the general population, but there is no one-to-one link that if the father or mother is affected, then the child will be affected. That's not true for Alzheimer's.
Thank you, Dr. Sathe. And lastly, I know that you did talk about the treatment as well as how to get diagnosed. But is there anything that can be done to prevent these memory disorders?
So far, what research shows is that keeping your brain stimulated is the best way of preventing, not necessarily Alzheimer's disease, but preventing memory loss in older age. And there is a lot of encouragement nowadays to, like you said, maybe learn a new language or develop a hobby or challenge yourself with puzzles. Because the more that the brain is challenged, the more it seems to be able to keep its capability for a longer period of time. And given that the longevity of life is increasing, we will probably require it for longer periods of time. So it's not a bad idea. And there is always good recommendations like, moderation of alcohol. Do not smoke. And those are always advisable and doable at all times.
Thank you so much, Dr. Sathe. And I know that our discussion is not over yet because there are many more memory disorders that is impacting many people's lives today. And our viewers will need more information about all those memory disorders that we have not discussed in this episode. So I see that we are going to invite you again, and we will be talking a little bit more about the brain and memory and how we are going to have some information that will help us to prevent and as well as take care of ourselves so that to a certain degree we will avoid or prevent these memory disorders. And if someone is having those memory disorders, then we will learn about what's the best way to get diagnosed and what are the treatment options. So I want to thank you for your expertise, your time that you provided by coming on this show on Healthline. And I look forward to see you again.
Thank you, Varsha. It was my pleasure. Thank you so much for having me on the show.
So dear viewers, this was a wonderful discussion with Dr. Swati Sathe, who is a neurologist, and she's also working extensively with Huntington disease as a clinical researcher. I would say that I hope you enjoyed this show, you learned something about memory, and I want all of you to come back and listen to another episode of Healthline on TVAsia Telugu channel. I will say bye for now, your host Varsha Singh. Until next time, don't miss another episode. Healthline TVAsia Telugu channel. Bye for now. Thank you.